No, the nice thing about this meeting is, I'm more a basic virologist, and it's always good to meet people from a little bit disciplines around it, because it gives a broader perspective. So I got some very great questions. It's always a fine line between naive questions and actually very good questions. So that was nice.
Yeah, so we are very excited. I'm excited to see more attention being put on NTM infections, or non-tuberculous mycobacteria. So these are ubiquitous environmental organisms that don't typically cause infection, but when they do, it's very, very difficult for patients. There's a lot of wide open science there, a blue sky science, where people need to figure out how to evaluate therapeutics preclinically and then develop the regulatory pathways to translate those into the clinic. So I'm seeing more attention on that, and we're very excited and interested in this.
So I like immunotherapy a lot, because I believe that immunotherapy is the future. Any antibiotics are bound to develop resistance on the long run. So I attended yesterday a very nice session whereby there were actually monoclonal antibody treatment against Klebsiella, carbapenem-resistant Klebsiella pneumoniae. And then this morning I also attended a very nice session which was also immunotherapies against infectious disease, mainly targeting virus infections, but it included several immunotherapies, included CAR T cells, monoclonal antibodies, and basically boosting the immune system and the host. So focusing on the host rather than focusing on the microbes. So these are the two really nice presentations that I liked a lot.
I've been excited to see more data from the Merino trial and seeing some of the MIC values and some of the outcomes based on MICs. So it's been interesting to see more of that data being released.
To me, I think that is the multidisciplinary approach to the patient. I think that one of the things that I've seen is that attending different meetings with different specialties, I'm very lucky to be attending not only critical care conference, but also respiratory care conference and ID conference. I think that I've seen that in the past was like ID conference just for ID people, critical conference for critical care people, and respiratory conference for respiratory physicians. So what I think that is the beauty of the conference in general, and this in particular, is that I have realized that the number of other non-ID primary specialties or clinical microbiologies is increasing. And I think that this is going to become a beautiful increasing knowledge of the patient, because we are going to, all of us, we are dealing with the same patient, but we are going to come from different angles. And I think that the success is to try to cover where the other cannot see. So I think that this teamwork with different specialties, in my opinion, is the most interesting part in.
I've been to a lot of great sessions, and I've seen a lot of really good posters. Yesterday, I had the opportunity to talk to the people next to me that were presenting posters, and our whole row was kind of stewardship type things. And honestly, the highlight of the conference for me is meeting new people. So the benefit of this being an international conference is meeting people that I never would have met in any other realm of life, really. So getting to talk to those people and learn about what they're doing at their institutions, what matters to them, and talking to someone yesterday specifically about my poster on aztreonam use. This person was like, we don't even have aztreonam in our country, it's not available, maybe we should be using it when we don't even have access to it. And someone on the other side of me is saying, we use it as a carbapenem sparing agent because we don't have a lot of resistance to it. So it's just really cool to hear those things and get a better understanding of what everybody else is doing, because you kind of get stuck in your own little bubble thinking, oh yeah, aztreonam is bad for everybody, as an example, and then you talk to other people and you're like, oh, actually, there may be indications for it. Maybe we should learn a little more about kind of the other settings that people are using it in.
So far, thus far, there was a Roche sponsored symposium on the flu, and it provided a great historical perspective on flu pandemics throughout modern history, and also had a lot of keen insights. There were some KOLs there that provided a lot of key insights on translational preclinical models in ferret that are useful for moving new agents forward.
I really enjoyed the debate yesterday about the rapid diagnostics for upper respiratory infections. It was interesting to hear both sides and see a lot of passion come out of that debate.
But I think, so obviously the session I was in that was really focused on the gut microbiota was obviously a highlight. There were really good talks from other researchers showing the implication of the gut microbiota in everything that's immuno and cancer therapy. And there was this really good talk basically putting forward the fact that knowing who's there in the gut only provides us with a very limited subset of answers, and we should really be focusing on what these microorganisms are doing. At the end of the day, it's really the bacterial metabolites and the compounds that these bacteria are producing that have a role in our health. These compounds can travel across the body, and that could explain like the off-target effects from the gut to other systems. So that was a really good highlight. And then obviously yesterday there was a phage therapy session, which was really exciting. There was a really good overview of the history of phage therapy. Phages have been discovered for hundreds of years now, and they are successfully being used in other countries against some specific bacterial pathogens. So putting that forward to say that, well, it's actually a therapy that we really should be focusing on, and in other cases showing the promise. And there was a good reality check with everything that was in terms of regulations, because we, as researchers, we want to actually provide our tools to the physicians, but we rarely, or some of us may, but I would say the vast majority of us don't really think about the regulations or how it can be transferred to society. And it was that talk was really a good reality check into like how would we actually call this therapy and apply it.
So when I go to the conference, there are two things that I have in mind. Number one is looking at diagnostic, because I know that early diagnosis improve our patients' outcome. And second is the description and follow-up update on the new agents that are on the pipeline. And I'm very happy to see that there are at least 5 different new antifungal that are in the pipeline and being tested in clinical trial. And lastly, this meeting also is very rich in pathogenesis and bench research. And I think that it's very important for us to understand the disease causing, to be able to come up with new diagnostic, including with where to prevent the disease.